As we celebrate Women's History Month, equity is at the forefront of the conversation. A few weeks ago, we talked about equity in the workforce.
And now we want to talk about equity in healthcare. Doctors say women around the world have struggled to get the care that they need and deserve.
Brianna Smith introduces us to two Pittsburgh doctors who are part of the progress toward providing everyone with optimal treatment.
Equality doesn't equal equity, and really equity is specifically giving patients and people what they need so they can achieve their best health, and we all have a part.
Dr. Tracy Conti is doing her part as the UPMC and University of Pittsburgh Family Medicine Chair.
It's so good to meet you finally in person.
And so is Dr. Margaret Larkins-Pettigrew. She's the AHN Senior Vice President and Chief Clinical Diversity, Equity, and Inclusion Officer. Both have spent more than 20 years in the medical field striving to make a difference. They focus on giving women and underserved populations the best care to create a strong community.
We have not paid attention to women as we should. We haven't addressed them in research. We haven't addressed them in educating our future leaders about their special needs.
These doctors say treatment has improved in recent years, but more needs to be done, such as prioritizing reproductive health, heart disease, and dementia among women, and outside factors.
It's the social determinants of health that impacts that health outcome. So when there is lack of available nutritious foods or places to exercise or economic stability in the home, even housing, that all impacts health.
As well as having a diverse workforce.
We know that there are more women in the field of medicine, that more attention gets paid to women, and then there's more access to them in research studies or specifically to recruit them.
And having access to care and creating an effective patient-physician relationship.
We are making sure we're partners with you, that we're listening to you, that we hear the voices of the communities and making sure we're reaching into the communities versus them reaching into us all the time.
Both Dr. Larkins-Pettigrew and Dr. Conti hope their respective local programs will help close the equity gap.
We're really investing in women. We're really making sure that we're covering their whole lifespan, but we're looking at other things like, work-life balance, how we're really taking care of them in a behavioral health and mental health space.
In 2022, AHN launched First Steps and Beyond to reduce Black infant mortality rates, which also decreases maternal deaths. UPMC opened the Matilda Tice Health Center in the Hill District to create a one-stop shop for medical needs with a bus stop and pharmacy nearby. And the UPMC Health Plan Neighborhood Center in East Liberty offers various health resources and child care.
It provides a place that people can go and access their video visits if they don't have that capability in their homes. There is food access there, so addressing the food insecurity by having a food bank there, as well as looking forward to having a food pharmacy program out of that space.
These doctors believe the progress will continue as long as the community embraces equity.
We are really thinking about women as leaders in this country. We have plenty of leaders and plenty of examples of women who are phenomenal, and we need to listen to women.
And it's not just about opening the door, but keeping that door open and pulling people through.
These doctors say it's a community effort and everyone will benefit. And some good news, more services are on the way. This July, UPMC will open a family medicine clinic in Shadyside. I'm Brianna Smith for KDKA-TV News.